Welcome to My Bariatric Solutions online guide to eating to succeed with gastric bypass. Throughout this information session, we will discuss the pre and post-op diet instructions associated with the gastric bypass and help clarify the specific aspects of the diet. Further, we will explore specific nutrition, exercise, and lifestyle tips that will help assist you in achieving optimal results following your surgery. If you have questions after this session, we invite you to write them down and bring them to your next appointment with us. 1 week prior to surgery, we ask that you start a high-protein, low-carbohydrate liquid diet to reduce the fatty tissue surrounding the liver to prepare you for surgery. During surgery, the surgeon has to work around your liver to reach the areas of your stomach they are operating on. By reducing the amount of fatty tissue, you are opening the pathway for the surgeon. We suggest you consume 4 to 5 high-protein, low-carbohydrate shakes per day, such as Premier Protein Shakes, Bariatric Fusion Shakes, or Nectar Protein Supplements. A comprehensive list of bariatric-friendly protein supplements will be provided prior to your surgery. We also ask that you consume at least 100 ounces of water, sugar-free flavored waters, or low-sugar electrolyte drinks daily. This includes Crystal Light, broth, Powerade Zero, or any other water-based sugar-free beverages. During this phase of the diet, it is imperative that you stick to the low-carbohydrate protein drinks and water-based sugar-free beverages only. No soups, blended cereals, or puddings are allowed during this phase of the diet. If you are a diabetic, you will need to speak with your primary care physician about adjusting your medications prior to starting your liquid diet. Failing to do so can potentially lead to severe episodes of low blood sugar, known as hypoglycemia. We suggest taking your patient education handbook with you to your doctor visit, as this handbook contains our recommendations for optimally managing your medications and blood sugars in diabetics who are consuming a liquid diet. If your doctor is unable or unwilling to adjust your diabetic medications during the liquid phase of the diet, please feel free to contact our office and speak with a registered dietitian so they may assist you. You will also need to stop taking all diet pills at least 2 weeks prior to surgery. If you have any history of chronic kidney disease, then you must contact one of our dietitians prior to starting your liquid diet to discuss your individual protein needs. Excessive protein intake in a patient with known kidney failure has the potential to worsen kidney function. 1 day prior to surgery, we ask that you consume only clear liquids, which include water, broth, Crystal Light, Propel, Powerade Zero, and sugar-free gelatin and popsicles. It is recommended that you consume clear liquid protein drinks on this day, such as Nectar fruit flavors mixed with water or Protein 2.0 clear liquid protein drinks. Both of these clear liquid protein options are located in our office for your convenience. We ask that you avoid liquids with red, blue, or purple dyes the day before surgery. Do not consume anything after midnight the night prior to surgery. If you are instructed by your physician to take a medication the morning of surgery, drink just enough water to swallow the medication. During days 1 through 7 after surgery, you will consume a clear liquid diet. You will need to sip liquids slowly and avoid all carbonated, sugary, and caffeinated beverages. You may begin drinking a clear protein drink, such as Protein 2.0 or Nectar protein powder mixed with water or Crystal Light 24 hours after surgery. If you are unable to tolerate the protein drinks, you can hold off on protein for 1 to 4 days following surgery and drink only low-calorie, water-based beverages. However, reintroduce your protein drinks as soon as the nausea resolves. Your protein goal will be the same as prior to surgery, a minimum of 80 to 100 grams per day, with a fluid goal of 64 ounces a day. To help prevent constipation, you will need to start an over-the-counter stool softener like Colace 24 hours after surgery. Avoid anything with laxatives, stimulants, and fiber. Days 8 through 14 after surgery, you can advance your diet to full liquids, which means any liquid that is smooth, pourable, and without chunks or lumps. First and foremost, focus on meeting your hydration needs of 64 ounces per day. Second, focus on increasing protein intake using full or clear liquid protein drinks. You may also have small amounts of other full liquids such as sugar-free pudding or low-sugar, low-fat Greek yogurt. You are expected to meet your fluid and protein requirements daily. You will begin taking your bariatric-specific vitamins on day 8 after surgery. Do not advance your diet early, as doing so could lead to serious complications following surgery such as a leak or infection. If you have diabetes or prediabetes, an autoimmune disorder, are greater than BMI of 50, are bipolar, have PCOS, are having a revisional surgery, or you are a prior nicotine or vape user, you will be instructed to continue with full liquids through week 3 to prevent medical complications. Patients with these conditions sometimes take longer to heal, leading to an increased chance for complications. During week 3 and week 4 after surgery, you are encouraged to introduce soft foods into your diet. If you were instructed to do an extended full liquid diet, you will start this phase week 4 following surgery. You want to start this process slowly and use your best judgment as to what you can consume. You want to eat your protein first so you don't fill up with non-protein items before meeting your daily protein goal. You will start to realize which foods you can tolerate and which foods you have trouble with. Each patient is different, and you can always go back to the clear liquid phase for a few days if you are not feeling ready to introduce soft foods. Week 3, you will start with soft proteins, but no meat products yet. These include soft scrambled eggs, fat-free refried beans, low-fat cottage cheese, and mozzarella cheese sticks. Week 4, you may introduce soft meats. Avoid items like chicken breast, beef products, or fatty fish like salmon. Soft meats include baked white fish, such as tilapia, canned chicken or chicken thighs without the skin, and tuna, chicken, or egg salad without any hard chunks of fruits or vegetables. Please avoid any spicy items, fruits or vegetables with peels, skins, or seeds, and raw fruits and vegetables. Starting week 5 after surgery, you can advance to normal textured foods. Remember, everyone is different, so it is important to listen to your body. If a food is giving you problems, make note of it and try something else. You may be able to introduce that food back into your diet later, or maybe that item is no longer tolerated by your body. To succeed with your surgery, you will need to adhere to the following recommendations on a long-term and consistent basis. Tip number 1, consume protein every time you eat and always consume your protein first. Protein is the building block of muscle, skin, hair, nails, and organs. It is vital to meet your protein requirements each day to ensure you are healthy after surgery. Adequate protein intake ensures that you lose fat and not muscle, and it also helps keep your metabolism high. For every pound of muscle you lose, you decrease your resting energy output by 10 to 20 calories per day. Protein is also a very satiating food, which simply means it helps to keep you full. In fact, people that consume protein at each meal and snack tend to consume about 400 calories less per day than those who don't. So by eating protein at each meal, you will be working with your surgery tool to help you feel more satisfied while consuming fewer calories. Adequate protein intake also helps to maintain a strong immune system, aid in wound healing, and prevent excessive hair loss post-op, which is a common issue after weight loss surgery. After surgery, you will fill up with 1/4 cup or 2 ounces of food. If you eat fruits, vegetables, fat, and carbohydrates first, then you will not have room for protein. Therefore, you must always consume your high-protein foods first before consuming anything else so that you can easily meet your protein needs. Continue to use 1 to 2 protein supplements each day to help you meet your protein goal if needed. Females require a minimum of 80 grams a day with a bypass, while men require a minimum of 100 grams per day. However, rather than striving for minimums, You should strive to meet your optimal level of protein on a daily basis. Your individual protein goal is based on your gender and height. Using the chart shown, find your individualized protein goal. The amount of protein you are consuming from solid animal protein sources can be determined using a simple equation. 1 ounce of animal protein equals 7 grams. So if you consumed 4 ounces of grilled fish, that would be equivalent to 28 grams of protein. Tip number 2. Follow the bariatric plate method of eating. You can use the plate method to help you consume the proper ratio of food groups. First, always eat your protein, and then if you are still hungry, focus on non-starchy vegetables or salad. If you are still hungry after that, then top off your meal with healthy complex carbs. Listed are good sources of proteins, non-starchy vegetables, and complex carbohydrates. Tip number 3, eat your calories. The gastric bypass significantly reduces the amount of solid foods your stomach can hold. Solid foods do a great job at filling you up and keeping you full, but liquids do not have the same effect. It is possible to cheat your tool by drinking high-calorie liquids, which will allow your body to consume unnecessary calories without filling you up. Avoid or limit high-calorie liquids such as juice, soft drinks, sweet tea, Kool-Aid, sugared coffee drinks, milkshakes, alcohol, and any other high-sugar, high-calorie liquid. Your liquids need to be water-based and contain no calories or very low calories only. Examples include water, Crystal Light, unsweet or artificially sweetened tea, green tea, Propel, Vitamin Water Zero, and Powerade Zero. 1 to 2 cups per day of sugar-free or artificially sweetened coffee is okay as well. Tip number 4, eat 5 to 6 small meals. In order to meet your protein requirements with your newly restricted stomach, you will have to eat 5 to 6 small meals each day, including 3 high-protein meals and 2 high-protein snacks or protein drinks to ensure your nutrition requirements are met. Consider these high-protein snack options. Tip number 5. Stay on track with appointments. In order to succeed with weight loss surgery, you must attend your follow-up appointments. Bypass patients should be seen at 1 week post-op, as well as 3, 6, and 12 months post-op, and again every year after. Failing to comply with your scheduled follow-up appointments generally leads to poor results. Tip number 6. Do not drink liquids while you eat. Drinking liquids during and up to 30 minutes after eating can cause vomiting, diarrhea, or cramping with bypass patients. By drinking soon after a meal, you are forcing the food to flow through your restricted stomach faster, which means you will feel hungrier sooner than you should. With a gastric bypass, drinking while eating is likely to cause dumping syndrome. Dumping syndrome occurs when the food from your stomach moves too fast into your GI tract and causes diarrhea, cramping, shakiness, sweating, and dizziness. Tip number 7. The intake of concentrated sugars and large amounts of fats can inhibit weight loss in bypass patients. To assist with weight loss, all patients should limit high sugar, high fat foods, as well as refined carbohydrates such as white rice, pasta, and bread. These foods can cause GI distress. High fat, high sugar foods can also cause dumping syndrome in gastric bypass patients. Tip number 8. Take your time eating your meals. Eating fast can cause several side effects that can easily be avoided if you take your time. You are also better able to consume fewer calories if you eat slowly. You should take approximately 20 minutes to eat a meal. Tip number 9. There are required vitamin and mineral supplements for all weight loss patients. All recommended supplements can be purchased at any of our offices or via our online store for your convenience. All patients are required to take a bariatric-specific multivitamin, 1,200 milligrams of calcium citrate a day, and a sublingual vitamin B12. When taking iron or a multivitamin containing iron, it is important to separate your iron from your calcium supplements by at least 2 hours, as calcium inhibits the absorption of iron. Tip number 10. Weight loss surgery alone will not help patients lose weight long term. It is equally important to consume a good diet and to exercise regularly. Tip number 11. In addition to your follow-up appointments, we encourage you to attend our support group meetings. We provide a variety of support groups, including online meetings, to help you through every stage of your weight loss. You can find our group support calendar online, or feel free to ask any of our staff members for a copy. Support group meetings are a great way to get the support you need to succeed. For the first 30 days after surgery, you will need to take it easy, but that doesn't mean being sedentary. Start walking regularly for small amounts of time, increasing intensity and duration as you feel better. Avoid any heavy lifting. After 30 days, your goal is to walk for at least 30 minutes, 5 days a week or more. You can start adding resistance training for at least 20 minutes, 2 to 3 days a week if you are feeling well enough. Please see our exercise specialist at your pre- and post-op appointments if you like measurements and body composition testing performed regularly. Cardio helps to keep the heart healthy and prevent many diseases. It also helps with weight loss and weight management. You are better able to control your mood and mental health, and your ability to perform certain activities will be much easier if you are adding cardio regularly into your exercise routine. Strength training is extremely important as it slows the loss of bone density as you age, builds strong, healthy muscles, keeps your metabolism revved up, and helps with long-term weight loss and weight management. Start introducing resistance training as soon as you are cleared and comfortable to do so, and continue performing these important exercises for life. Ideally, a good exercise program consists of half cardio and half strength training. Flexibility training benefits your range of motion, improves performance of various activities, and reduces your risk for injury. Try incorporating stretching into your regular exercise routine to maximize your chance at long-term weight loss success. Thank you for watching My Bariatric Solutions Eating to Succeed with Gastric Bypass.